Good day, respected panel members, our thesis advisor. We are Group 3C, Group 5 from the College of Nursing, University of the Immaculate Conception, and we are here to present our research proposal entitled Knowledge, Attitude, and Practices on Animal Bite Services Among Higher Education Students in Davao City. Our study focuses on understanding how college students perceive, respond to, and utilize animal bite treatment services. Rabies remains one of the most preventable yet fatal diseases in the world, and increasing awareness among the youth plays a vital role in its eradication. According to the World Health Organization, as of 2024, rabies causes an estimated 59,000 deaths every year across more than 150 countries, with 95% of these cases occurring in Asia and Africa. In the Philippines, the Department of Health reported 426 rabies-related deaths in 2024, which is almost double the number in 2020. Despite being 100% preventable through timely vaccination and post-exposure prophylaxis, rabies continues to claim lives because of the limited awareness, cultural misconceptions, and delayed medical treatment. The Philippine government has established Animal Bite Treatment Centers or ABTCs to make vaccination and health education accessible, but many still fail to seek immediate care after being bitten. Most studies focus on pet owners and rural communities, but little is known about how higher education students, a well-informed yet understudied group, perceive rabies and animal bite services. Hence, this study aims to determine their knowledge, attitude, and practices on animal bite services to support future educational and preventive interventions.
Existing literature reveal that while people recognize rabies as fatal, there remain significant gaps in knowledge and correct practices. For example, Verma et al. 2025 found that although most respondents knew rabies was transmitted through animal bites, only 26% knew the proper first aid, which is to wash the wound with soap and water for 15 minutes. And in addition, Banerjee et al. 2024 also observed that even nursing students lack knowledge of the National Rabies Control Program and the correct wound management procedures. In the Philippines, study shows that many still rely on traditional remedies, such as applying vinegar or coins on bite wounds. These misconceptions delay proper treatment and increase the risk of fatal infections. Moreover, Dizon et al. 2022 and Saito et al. 2024 emphasize that knowledge and preventive behavior differ by educational level and access to health services. These findings highlight the need for targeted health education among college students who can serve as advocate for rabies prevention and community awareness.
This study is grounded in three nursing theories. Nola Pender's health promotion model explains how knowledge and perception of benefits motivate people to engage in preventive health behaviors. Margaret Newman's health as expanded consciousness theory views health as increasing awareness that helps individuals make informed health choices. And lastly, Imogen King's goal attainment theory emphasizes collaboration and goal setting between individuals and healthcare providers to achieve better health outcomes. On the other hand, our conceptual framework illustrates that knowledge and attitude serve as independent variables, while practices represent the dependent variables. This means a student's understanding and perception of animal bite services can influence their preventive actions, such as wound care, vaccination, and seeking help from ABTCs.
This study aims to determine the level of knowledge, attitude, and practices regarding animal bite services among higher education students in Davao City. Specifically, it seeks to answer what is the demographic profile of the respondents, what is their level of knowledge, attitude, and practices regarding rabies prevention and animal bite services. Is there a significant relationship between knowledge, attitude, and practices? We hypothesize that there are no significant relationships between knowledge, attitude, and practices regarding rabies and animal bite services.
This study is significant because it identifies existing gaps in rabies awareness among higher education students. For students, it will enhance their understanding of preventive health practices and responsible pet ownership. For healthcare workers, it provides data that can help design educational programs focused on rabies prevention and the proper use of ABTCs. For the community, it promotes timely reporting of bite incidents and a greater trust in public health services. On a larger scale, this study supports Sustainable Development Goal number 3, good health and well-being, particularly reducing the preventable diseases through education and awareness. To clarify key concept in this study, Animal Bite Services refers to the programs and interventions provided by animal bite treatment centers, including vaccination, wound care, and rabies prevention education. Knowledge pertains to the accurate information about rabies and its prevention. Attitude reflects the perception towards rabies prevention and ABT's utilization. Practices involves actual behaviors such as wound washing, vaccination, and seeking medical care after exposure.
Methodology. This study will use a quantitative descriptive correlational design to measure the relationship between knowledge, attitude, and practices on animal bite services. We will use a structured and validated questionnaire adapted from Davlin et al. 2014 and Rana et al. 2021, composed of 4 sections: demographic profile, knowledge, attitude, and practices. A convenient sampling method will be applied, targeting 100 higher education students from various programs and year levels in Davao City. Descriptive statistics such as frequency, percentage, mean, and standard deviation will describe the respondents' profiles and responses. For inferential analysis, chi-square tests and z-tests will determine if there are significant relationships between the variables. The study will be conducted in a private higher education institution in Davao City. Data collection will be done through Google Forms to ensure accessibility and convenience. Only respondents who provide informed consent will participate, ensuring voluntary and ethical participation.
The study will focus only on higher education students enrolled in one private institution in Davao City. It will assess their knowledge, attitudes, and practices regarding rabies and animal bite services. However, the study is limited by its sample size and setting, which may affect generalizability. Data will also be self-reported, which can introduce bias. Despite these limitations, the study will provide valuable insight into the current awareness and behavior of the youth regarding rabies prevention.
The researchers will strictly adhere to ethical principles of beneficence, non-maleficence, justice, and respect for persons. Prior to data collection, approval will be obtained from the College Research Committee and the University Research Ethics Board. The study will comply with the Data Privacy Act of 2012 to ensure that participants' information is protected at all times. All participants will be informed about the purpose of the study, voluntary participation, and confidentiality of responses. That concludes the presentation of our research proposal. We now open the floor for your questions and suggestions. Thank you and good day.